that's a big component of overall health of the body, is a strength component. And so when it stop chasing pain, you certainly treat pain. So if somebody comes on in and their hip is hurting, I'm going to treat there, partly because you expect me to, quite honestly. So I'm going to satisfy your need for me to do something to your hip. But then I know I'm going to look somewhere else, right? Especially when it's chronic. Here's how I look at it. If you come on and it's chronic, I pretty much know that's not where it is. Because most of the time, stuff would have worked to help you feel better, especially because there's a lot of really gifted therapists and programs out there that can help you. And I say to myself, I find out what everybody's done before they come in to see me, and I think, well, I'm not going to do that, because if that's what you needed, you wouldn't be standing here.
Yeah, I agree.
I'm going to expand my parameters of looking at a different place, assuming that you had a proper evaluation. And I got to make sure that, hey, I need to make sure you don't have a tumor in your hip, because you might. I mean, you need to go through your check boxes and your red flags, but there's also a difference between acute and chronic pain. I mean, if you slip and fall on your left hip and your hip hurts, well, I might want to look there. But, but then I'm going to ultimately ask, my next question is, why the hell did you trip in the first place? Because maybe you have a balance problem or a reflexive stabilization problem. So I'm going to have you fix your hip medical wise, and then you come see me after that. So if your leg's hanging off, you're not going to come see me for a lymph reset. You're going to put your leg back on, and then you better see me afterwards for some lymph resets, because it's going to be a mess in that system. I can tell you that much. And so that's where all of these places and all of these systems come together. And that was one of the biggest things in the beginning that really affected me, because I was very focused on pain sites in the beginning. And then one of my mentors that I studied with, his name is Gray Cook, he started to teach a principle of non-painful dysfunction, which means it doesn't hurt there, but it just doesn't function as well as it should, for whatever reason that you see. And his novel idea was, how about you treat there too? And I thought that was like discovering the Ark of the Covenant. I was like, oh my God, that's like amazing. And I started to have some great results. But a few years later, I realized that I was still stuck in just looking at one system. I was still looking at the musculoskeletal system. And that's where my journey started to begin, more on looking at neurology, and then the lymph at the time through the Chapman points through exposure to you. And it wasn't until I just started to dig deeper and dig deeper and dig deeper and really begin to focus on all the other different systems and how they work together. So now when I see you move something, I'm going to look at musculoskeletal, but I'm also going to realize that there's a lot of other systems that I might have to check. And then your history will probably tell me what those might be.